Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you. Welcome back to Between Two White Coats. Amber and I are talking about a topic today that I think affects just about anybody who uses their phone or a computer.
Well, and it might be how you found us.
And it might be. That's exactly right.
So it's not all bad.
We're
great.
Yes. Social media and medicine, the internet and medicine, just sort of this whole, I just heard that you called us great. I love that.
I know.
Like
it took a second
to
process.
back. It circled back. Yeah. So let's talk about social media and medicine and kind of what's out there. And of course, like everything, there are some wonderful, reliable resources.
Yes.
There is some real crazy stuff. So our chief of operations here at Our Family Health, Jamie, and I have known each other for a long time. And
Like long time, we mean like
kindergarten. Grew up together.
Yeah.
Yes. And have a lot of fun working together. I really appreciate Jamie. He hands me his phone the other day and he's like, hey, my son just sent me this Instagram. And so it's a woman who is probably in her mid-50s and is fit, like cut, perfect, muscular. She's doing this entire Instagram post in her sports bra and her like running shorts. And I don't post a lot on social media, but I promise you I'm not posting.
Well, I told you earlier, you told me to bring shorts today. I'm like, no, I'm wearing leggings.
Yes. So
and I'm not in my 50s.
Exactly. So first she looks fabulous and she's in a sports bra and running shorts. And she starts very quickly by saying, I've made a lot of really great health changes in the last years. I have changed my entire diet, started a GLP, and got on hormone replacement therapy. But what I want to talk to you about today is, and then she went into, and there she is, fit as all things, that the third thing that she shows is she's standing on this like vibrating device. It reminded me of like
the old shaky things?
Yes, our grandmas or Suzanne Summer, where it's like that band went around your waist and it would shake the fat off. And then she also talked about how she does dry brushing and how she rubs castor oil on her stomach. And then we're like, look at this lady. And I mean, educated people, we're finding ourselves going, wow, I cannot imagine what happened to the sales of castor oil, dry brushing, and whatever that little vibrating device was that she was standing on that was making her thin, because everyone's going, oh, that's why she looks like that. Yeah. And I'm like, she was kind enough to let us know in the first 10 seconds
it was
that she had
testosterone.
GLP-1, testosterone, estrogen, and a complete diet change.
Yeah.
And she's probably working out 4 hours a day. I don't think it's the dry brush that made her look that good. And P.S. I've been dry brushing for 10 years and I'm not running around in a sports bra anywhere. So social media can be very misleading in so many arenas.
Yes.
Healthcare is one of them.
Yes.
And that is kind of one example of where you watch that and you find yourself getting very emotional and very pulled to buy some castor oil and start rubbing it places. And then you go, okay, why am I not getting the same outcomes that lady got? And I'm sure she's sponsored by all of those things, or at least one of those things. Because, influencers get free things. They get paid to get you to buy stuff. A lot of this is ad space.
Yeah.
This is when
it's a new type of advertisement instead of, I almost said bulletin boards, but that is not what I meant. I meant billboards.
Billboards.
They still use billboards, but like you look like you don't. Half the time now, if I'm looking up something, I go to their Instagram.
Yes.
I often will not go to their website anymore. So social media definitely.
The influencers are a huge part of marketing and advertising. And so you got to kind of look at this. So when stuff pops up on people's feed and it's then populating their brain, what's the takeaway?
So
should I go buy that?
Maybe.
Dry
I
brush
don't know, maybe. But I will say to patients, like often they'll say, well, so-and-so or whoever on social media said this. So I will say, like, initially, like, evaluate who they are, what they're doing. Are they just trying to sell you something?
Right.
To take a second to pause and stop and listen to yourself often, because when you start listening to yourself talk about other things, you're like, okay, that does sound kind of silly.
Yeah.
Like rubbing castor oil on your stomach may be great, but it also might be stupid.
I'm not finding the science behind that. So one of the things that matters when we're reading medical research for us to ask ourselves is, we first ask who did the research and what was in it for them.
Yeah.
And so when you have third-party people who are not going to make an extra dime based on the outcome of this research, that puts a lot more weight on the research.
Yeah.
When you have a pharmaceutical company who is trying to sell a specific drug that did all the research by people who are employed by them, it feels as though they might want to have a certain finding, and they might even subconscious bias may be there. And so they're probably not the best resource. So first ask yourself, are they being paid to tell you this? And when we look at any research medically, we ask, are they being paid?
And they have to give the disclaimer.
Yes.
So and social media influencers, which I think they do have to give disclaimers if they do now, if they're sponsored or if it's, an ad thing.
And they should be very clear. Like, it would be, I think that good people who, even if they are working as influencers, start with some of their credentials. So they would say, when I'm saying things for our Family Health Center on our social media, I'll say, this is Dr. Plaster, and you'll say, this is Amber Foster, nurse practitioner here. So you at least understand what our job here is and what our education might look like.
Yeah.
And you can look us up and find our bios and say, okay, this is a person that I do believe that I could trust. They have some area of expertise. Now, if I say, this is Dr. Plaster, and I like to tell you how to change the oil in your car,
don't listen.
You should 100% not do that. Yes. And so I think just because someone's an expert in one thing, let's figure out, do they have the expertise there? So yes, who is it, and what is their motivation?
Stop and listen. Yes. Next is if it's something that is catching your attention, consider your emotional response. So like if it is something about mental health, or if it is something about weight loss, or if it is something about blood pressure, or literally anything that has to do with medical derivatives, if it is causing you to either perk up and listen or feel emotional about that, then maybe it's something that you need to go and have a discussion with your primary care or your medical provider.
Yes, and instead of just acting on an emotion, ask yourself, why is that emotion there? And is there something that needs to be done with it? And let's recognize that a lot of stuff that's happening on social media is an advertisement. It used to be so easy to tell the advertisements, you're watching a TV show, the TV show stops, commercials come on. And then the TV show starts again. So you knew exactly what the advertisements were. In social media, it looks like it's part of the thread. It's just like, oh, I don't know who that person is, but they clearly want to talk to me about something. Are they a friend of mine?
Yeah.
And you don't even realize that it's an ad.
Yeah.
And advertisers know how to get an emotional response.
Yeah. That's their whole goal.
It's their whole goal. And so next thing you know, you're acting out of emotion instead of acting from more of a cognitive place. So be in tune with your emotions. That's great advice.
And then investigate the source, which you kind of mentioned. So where is it coming from? Who are they? If it's something that they're being sponsored by and it's some random tea, has the tea been studied? Which I don't even know how you would do that. But, if it's giving you like, hey, it's going to give you focus and energy, but it has 300 milligrams of caffeine and you have high blood pressure, you probably don't need to drink it.
And, social media kind of pulls over into podcasts, pulls over into YouTube and these other resources where you can find a lot of people who are medical professionals. And so they introduce this doctor, and then you realize, well, are they a doctor with a specialist in urology? Are they a chiropractor? And what are they talking about? And is it their area of expertise? Right. And
are they a doctorate of nurse practitioner? There is a difference.
Yes. And so are they in their area of expertise? But then also, I think some of the more popular podcasts, and two that I really appreciate, are Peter Attia's podcast, The Drive, and Andrew Huberman's podcast, Huberman Labs. And they will tell you why they are saying something. So they don't just say, you should do a cold plunge. They say, I do a cold plunge because research article 1, research article 2, and research article 3. And they tell you the articles, you can look it up for yourself, and you can dig and find the evidence of which they are supporting their comments with. I think that's really important. So I think know who you're listening to, and know that they're speaking within their area, but then what are they basing it on? And they're like, oh, I lost. And don't get pulled into the one person antidote. I love to say the sample size of one. When one person's telling you their personal story, it will create an emotional response. It is not good research. So a sample size of one, I lost 40 pounds doing this. Well, what else were you doing? And you're just one person.
Yeah.
And so is there research that supports that?
And there's also too, like, fitness instructors, like, you know, they'll tell you to do all this whatever. I don't do those things, but, like, you know, do this particular exercise and whatever. But they may not have certifications, you know, so just being cautious about that. So it's not just medical doctors, but also nutritionists or people who are, you know, there are people that go to school to be a registered dietitian.
Yes.
Like, that's different than getting a certificate.
Personal trainers, but Pilates certified.
Yeah.
So now the thing that I'm seeing in social media is wall Pilates. If you want to look this good, you'll do wall Pilates.
I've seen those, and let me tell you, I
They're
want to
popping
do
up.
wall Pilates, but I know that is not what's going to.
I probably said Pilates in my house, and my phone heard it,
I know.
and then it starts popping up, and then you see it more and more. And then a coworker here was telling me, I was like, "You look great. You've really slimmed down." And she's like, "I'm doing wall Pilates." And I'm like, "Of course you are. You're seeing the same stuff as I." Now, good for her, because she actually got off her tail and started doing it. I was just like, I don't know what this ad is. But those kind of things start popping up. And then, but it is also like, I'm seeing some of the stuff of the wall Pilates where they're crawling their feet up the wall and I'm like, you could also get hurt.
Yes.
So let's do this safely. And the Pilates instructors that I know that are certified are talk about beginners in Pilates and how they need to be in a class with a certified instructor so they don't hurt themselves.
Yeah.
So yes, I think making sure that people are reliable in the information.
Yes. And we're not hating on social media, because honestly, if you rub castor oil on your belly, is it probably going to hurt you? No,
it's probably not going to hurt you.
It's not going to harm you. It
unless
might not help
unless you like slip out of the bed.
I know, right? Like something crazy, like when you spill it. But like some of the things are not going to harm you, and I'm not opposed to trying things.
Yeah.
But it may not help you,
and it may be costly. Not castor oil, but some of these other things, they may be expensive, and they're not going to help you, so they're going to hurt you.
Yes, and we're not ever opposed to having conversations with people, or like sometimes people will say, "Hey, I looked this up," or what do you think about this? And I always will say, like, I'm never opposed to you Googling anything.
People come in and they hang their head like they have done some horrible thing. And they're like, I know I'm not supposed to do this, but I Googled my symptoms. I'm like, why are you not supposed to do that?
Yeah.
And so Google your symptoms. And then if you see some like actor that's talking about your symptoms and what they mean, and this person has zero medical training, don't click on that one. Yeah. If you see the Mayo Clinic or the National Institute of Health, click on that one. Yeah. And so, go to, if you're Googling your symptoms, or you're reading about certain things that you may have concern with, if you listen to this podcast, then you go, I'm going to look into hormone replacement therapy further. Google it. Yeah. Look, there's great information. We're Googling stuff all day. Just make sure you click on the reliable resource and not the advertisement, and not the person who's maybe, speaking off of, if you have the option of looking at a doctor or looking at Jenny McCarthy's view on something medical, but if you want to get Jenny McCarthy's view on acting, you should probably take hers, not mine. Yeah. Just go for the expert in the field.
Yeah. One that's real popular right now is cortisol. So people will come in and be like, I want you to have my cortisol levels checked. And I'm like, I'll be more than happy to do that for you. But often if you have true cortisol problems, like it's a major medical diagnosis. Yeah. Like we have natural rises and falls of cortisol. So I'm like, I'm never opposed to talking about it.
I have checked a lot of cortisol levels over many years, always because someone asked me to, never because I thought that it was the best thing to do. And they've always been normal.
Yeah. So, but I'm saying like that's kind of trending again, I guess. And so like that's like I'm never opposed to doing something and saying, hey, of course we can have a discussion. And then I will tell them like, I don't know that that's necessarily what it is, but if it makes you feel better and it's not bad practice, I don't mind doing it.
And so one time I had a patient come in. I was a young doctor and maybe my first or second year of being an attending. And this patient was like, I Googled this and I'm pretty sure this is what I have. And it was an extremely rare liver disease that I had never heard of. So I was like, well, I'm glad you Googled it because I'm about to Google it and figure out what it is. So I was like, well, that's interesting. But what I'm looking at here in this medical resource says this would be the test that we do to see if you have that. And there were some simple blood tests. And so I did the simple blood test. The blood tests were showing positive for extremely rare liver disease. So I sent her to a hepatologist. This person who I've never met calls me and says, I just want to tell you how impressive it is that you came up with that diagnosis. You were right. And I was like, well, that is because I am so smart. But I was like, no, I didn't come up with that diagnosis. The patient actually came up with it because people know themselves. They know what is ringing true for them. And when they read it and they're like, oh, this is me, this is me, this is me. It's not always right, but it's not always wrong.
Yeah, and I'm never opposed to having the conversation.
Never opposed. And I'm never opposed to turning over that rock to make sure, because there's a lot of great information out there in the internet, and try to find the right resource. There's also a lot of really bad information out in the internet. And so you've got to have a questionable eye when these things pop up. And I think specifically in social media, we don't realize how much is actually for sale.
Yeah.
It's actually an advertisement. And it's not there to inform you and to, be for your best benefit. It's there to get you to buy something, to get an emotional response and get you to buy something.
And I will buy some stuff off social media. I mean, I don't usually buy health stuff. I'm buying some sort of outfit they can influence me.
Oh yeah, we're influenced. But we're all influenced.
Yeah.
And so let's just try to be influenced in the right way.
Yeah.
I think I'm glad that medical stuff is popping up because that means people are interested in it.
Yeah.
I'm glad that people are going down those roads, but maybe before you put all of your eggs in that basket, just make sure you've done good homework or consulted your medical provider.
We like to leave you on a good note. Here's today's Tell Me Something Good. Shortcuts. I hate to cook. Most of you know this about me. It's not a secret. But I like to buy, I'm laughing because I can't believe I'm saying this, mashed potatoes already made. Bob Evans is my friend, and I just add butter. Sometimes I'll add salt and pepper. Sometimes I'll dry ranch seasoning. My family thinks they're amazing, and I did nothing but microwave them. So today's Tell Me Something Good is any type of cooking shortcut is my friend. Thank you for joining us today, and until next time, take care of yourself.